Well, hello everyone, and welcome to Nutritious Bites. I'm so excited to have you here today. My name is Whitney Bignell. I'm a registered dietitian nutritionist, licensed in Georgia and Tennessee, and super excited to be talking to you today. I am recording this presentation and we'll upload it to a YouTube channel afterwards, just in case anyone wants to watch after we join. So great to see everyone here today. I'm excited because we're going to be talking about gut health today. Um, as we get ready to go into the fall season, the holiday season, okay, good. I did unmute my microphone. Just checking. Really excited because as we go into the fall season, sometimes our gut health can get a little bit off kilter, right? We may be eating a lot of foods that we haven't had in a while. We get off of our normal schedule, and all of these things can kind of throw our gut health out of whack, and we can start having some digestive issues. So hopefully what we talk about today is going to be a little bit helpful as you go into the fall holiday season. Just some things to keep in mind to help keep your gut healthy as we head towards the end of the year. So I'm going to go to my next scene and see if we've kind of got it set up right. Yeah, hopefully you're going to be able to see the entire screen on this. All right, so I'm going to be going back and forth between some windows for a few moments here. So bear with me. There we go. Now I've got the slides moving. Hopefully you can see them okay. So here is just an overview of what we're going to talk about today. How can you tell if you do have a healthy gut? What are some of the changes that kind of come with aging, and what can you do about that? We're going to talk a little bit about fiber and gut health because, as I'm sure you know from many of our talks with you guys, fiber is so important to keep everything moving regularly, as well as to have some additional health benefits for you. We're going to talk just briefly about probiotics and prebiotics, what they are. Can they be useful for some people, and what you need to know about those products, and the products that are fortified with probiotics and prebiotics. We'll talk about some common digestive problems that we have as we age, and what are some recommendations to help with that. And then I'll give you just a little brief overview of some of the research that's going on related to the gut microbiome right now, and what we may be talking about in the future. It's definitely an exciting field within the area of nutrition. It is still in its infancy as far as research goes, so I'm not going to have anything that I say definitively, yes, you need to take this probiotic for this condition. But I just want you to know what's going on out in the field of research, because we might have some of those recommendations coming down the road. So let's get started. Um, how can you tell if your gut health is doing okay? And you guys can put any comments in the chat. You can unmute yourself. What are some ways that you know you've got a healthy gut? Regular bowel movement. Thank you, Tasha. Absolutely. Yes, that's kind of the number one thing right there. Any other ways that you know you've got a healthy gut going on? And it's great if you guys are discussing this, over at ACCA as well within your group. All right, so I'm going to give you something that I found online from the Center for Functional Health, and I've got the website listed at the bottom there. So yes, absolutely, regular bowel movements. We call them BMs in the in our charting and everything like that. So regular BMs, having a normal transit time. is one thing that you want to look for, and that kind of goes to that regular bowel movements. This is different for everybody, and sometimes it does change a little bit as we age. For most people, they'll notice that kind of their regular transit time is anywhere from 12 to 24 hours. So they may have, 1 to 2 BMs per day. Some people, it may be a little less frequent. Some, it may be a little more frequent and still be normal for them. So this is where you have to get to know your body and know what is right for you. And the key is notice when there are changes to your transit time. And this is when you want to, share that with your healthcare provider, to see, what is going on with that. So, to help improve your transit time, and we're going to talk about this as we go along, you want to be sure that you've got foods that are high in fiber, because that's going to help bulk up your stool and get it to pass, through your digestive system as you go. A lot of people find that dairy, processed foods, and foods that are higher in fats, they are a little more challenging for your gut to digest, and they can tend to slow your digestive system down. So it may be that you want to try limiting those foods in your diet and see if it improves your transit time. Um, Another thing is that physical activity is really important. Our gut, it is muscles, and as such, they need increased blood flow to get them moving. So when we are moving, we are increasing our blood flow to all of the organs of our body, and that can help with increasing transit time. Some people find that they might need to take some supplemental fiber, psyllium fiber, things like Metamucil, that can help keep you moving as well. I would say you want to talk with your healthcare provider first, to be sure that that's right for you. Another way that you can tell that you have a healthy gut is if you not only have regular BMs, but you have good BMs. The quality of your stool is good and healthy. So there is something called the Bristol Stool Scale, that you can look up online to, see how your stools are kind of matching up with that. So things that you're really looking for are that the texture should be relatively smooth. If you have got some of those kind of lumpy, bumpy poops out there, that usually means that you've got some constipation issues going on. Whereas if you've got really liquidy stools, that's diarrhea. That could, be that you've got something going on with your bowel. If you're on antibiotics, that's fairly common for you to have loose stools. Or if you have some kind of infection going on, that can also cause loose stools. So you definitely want to talk with your healthcare provider if you're having that issue. Your poops should also be more sausage shaped, than, kind of the little rocks and those kind of things. And they should also sink down. So if you have stools that tend to float, that means that you may have more fat in your stools, and you might be having some absorption issues with fats through your gut. So if you notice that you're having more poops that are floating, you want to talk with your healthcare provider about that as well. Another way to know if your gut is healthy is that you don't have excess gassiness or bloating. That's one of the first things you notice when your gut's not healthy, right? Is you have a lot of pain, you have excess gas, and you just kind of notice that things are, you know, maybe feeling like you're going to pop, right? So some things that can help with the gassiness is, one, pay attention to what foods you're eating that cause excess gas. Keep a food log for a few days if you notice that you're having a lot of trouble lately. Unfortunately, a lot of times legumes, are good. Beans and legumes. They're great with fiber, but some people don't tolerate them super well, and they can cause a lot of gas. Artificial sweeteners, especially those that have sugar alcohols in them, like sorbitol, those can cause a lot of gas issues and can actually lead to sometimes a little bit of leakage problems. So be careful if you're having too many mints or sugar-free gum, those kind of things. They can really get to your digestive tract. And then for some people, they're lactose intolerant, and then that can cause issues with gas and bloating. A lot of people, you realize that you're lactose intolerant earlier in life, but sometimes even as we age, and there's really no explaining it, we might start tolerating those dairy products a little less and can start to have some issues. Um, you might also want to take a short walk after, especially having a large meal, because once again, that movement helps to increase the movement in your gut, and that can help move things out, gas included. Limiting your consumption of carbonated drinks. Sometimes I just really want a soda water for some reason. I love carbonated waters, but I do notice that sometimes it does lead me to have, some more issues. So carbonated beverages, soda, waters, those kind of things, they can actually increase the gas in your system too. Um, and some natural remedies like ginger and peppermint tea, they can help reduce gas and bloating. Anytime you're taking supplements or even natural remedies like that, you want to talk to your healthcare provider to be sure that that's okay with any medications that you're taking and those kind of things. Another way that you can tell if your gut is healthy is if you are having good sleep and high energy levels. So, and this kind of goes both ways as far as sleep goes. If you're noticing that your sleep is somewhat disrupted, that can mean that you've got something going on with your diet. Especially if your sleep is disrupted because you're having heartburn at night, which is one of the worst things that can happen, right? Because a lot of times it can feel like you're having a heart attack, and it's so uncomfortable. So this is where you want to pay attention to foods that might make heartburn worse. Um, things like having caffeine later at night. I know most of you guys do not drink coffee in the evening, but other things like chocolate contains caffeine and other substances that can increase your heartburn as well. Having higher fat meal not too long before you go to bed, that can increase your risk for heartburn and things like that. So really paying attention to what you're eating that leads to you having heartburn or other issues at night can be helpful. It's really recommended to have your last meal or snack about 2 to 3 hours before you go to bed to give your body time for the digestion to be taking place, and for you to then be able to go into a good sleep afterwards and decrease the likelihood that you're going to have heartburn or indigestion. Um, the other thing about our gut health is that we have the micro, the gut microbiome, and we're going to talk about this a little bit at the end. That there's a lot of research to the hormones that are uh, created and secreted by the bacteria in your gut, and how that affects the gut brain axis. And some of this has to do with sleep. So sometimes, if our gut microbiome is a little bit off kilter, it can actually shift our circadian rhythms. So our sleep wake cycle can get off track. The other thing is that if you're not getting very good sleep, maybe it's because you have a little more stress in your life, that stress can actually impact the gut microbiome as well. So this kind of all goes hand in hand, that we want to do things to help manage our stress, um, and then also do things that will focus good sleep. So practicing that good sleep hygiene is really important. Keeping your room dark at night, a little bit cooler at night, so that you can get good sleep. That can help you get back into the right circadian rhythm. Um, and then just kind of practicing some relaxation techniques at night can help you get better sleep, which can help the bacteria in your gut and vice versa. And then, kind of the last way you know you have a healthy gut is having sharp memory, mood, and focus. This goes back to, um, the fact that our the bacteria in our guts, they produce a lot of substances that can act on our brain, and one of those is serotonin. Some research suggests that up to 95% of your body's serotonin is actually produced in the gut. So anytime our serotonin levels are off, we know that that's going to impact our mood, our memory, our focus. Um, so, one of the things that we can do is to once again find ways to better handle our stress, because that is going to help our gut microbiome as well. Prioritizing rest and relaxation. We're about to get into a pretty busy season of the year with the holidays coming up. So, finding time for yourself, making sure that you've got that downtime on a regular basis is really important. Practicing breathing techniques when you're in a stressful situation can help. Um, the brain and gut are connected. So, a lot of times when we're feeling really upset, where do you feel it? You feel it in your gut. You can start to, have some nausea, especially if you're getting really anxious or upset about something. You can experience nausea, and sometimes it can even go to other GI symptoms. So, practicing those breathing techniques to help yourself calm down in stressful situations, that can help your gut as well. And then reaching out to your friends and family for support, that is also incredibly important. So that's kind of some ways that you know you have a healthy gut. Let's talk a little bit about some of the age related changes to our gut that can impact our gut health. So as we age, most of the muscle function in the gut is preserved, but we still can see some slowing transit time. And I know a lot of you have told us before that you do suffer with some constipation issues. Um, some of that's related to not staying well hydrated. Um, and maybe not having quite enough fiber in your diet. So, those are some things that we look at. But then also, some medications can tend to dry you out, and that can lead to constipation. Some other medications can slow transit time. And then there are changes to our system if you have diabetes that's not very well controlled. That can lead to gastroparesis and those kind of things. So you have slow transit or almost no transit. And of course, at that point, you want to talk to your healthcare provider about that. So we're going to talk about, some of the recommendations for improving constipation a little bit, and a lot of that has to do with increasing your transit time. Our guts also have a decreased ability to absorb some nutrients as we get older. Um, Certain nutrients, like vitamin B12, do require more gastric acid to be cleaved from the protein that they're bound to and absorbed by the gut. So, as we get older, even if we do not have pernicious anemia, we still have a little more challenges with being able to get enough vitamin B12 from our food. So, that's why once we reach age 50, we really recommend that you eat fortified cereals that have the crystalline form of B12 in them, or talk to your healthcare provider about the best B12 supplement for you, because they come in several different doses. And so you want to, talk to your healthcare provider about, do you need one that's, 1,000 milligrams versus 2,000 milligrams. They just come in different doses. So talk to your healthcare provider. Some people do have pernicious anemia and even crystalline forms of B12 they're not able to absorb and use well. And so they may need to get the B12 shots. So that is also an option, that if you're very low on B12, your healthcare provider might suggest B12 shots as well. And then we also see changes to our actual gut microbiome, that there tend to be an increase in bacteria that require less oxygen to thrive. And I'm not going to say that these are bad bacteria, but it's just that you want to have a balance of the bacteria in your gut. And when you've got an increase in this kind of bacteria, they kind of become like the weeds in the garden, and they crowd out some of the other beneficial bacteria. So this is where, you can get some issues with bacterial overgrowth. And you would want to work with your healthcare provider about the proper treatment for that. So this is also where we want to be consuming foods that can, really increase the diversity of microbes in our intestines. So I want to talk just a little bit about fiber and gut health. So as you probably know from previous talks, there are two different types of fiber. Both are very important for health. Our soluble fibers are those that form a gel in water. And this type of fiber is really important for helping with blood glucose control and also cholesterol control, because it helps remove cholesterol from the body, and it also helps to slow the absorption of glucose into our bloodstream after we've had a meal. And of course, you can find soluble fibers in things like oats, fruits, vegetables. You can think about pectin, right? That's soluble fiber. And then insoluble fiber is that great fiber that helps to really bulk up your stools, that helps them move through the system. So, this is the fiber that we find in those whole grain foods, and also in fruits and vegetables, especially vegetables. You can think of kind of that roughage, right? And that helps move it through your system. The caveat to this, of course, is that you want to be sure you're drinking enough water with your fiber. And the recommended amount of fiber for women age 50 and older is 21 grams per day, and for men it's 30 grams per day. And if you feel like you're not getting anywhere near that, that is okay. What you want to do is increase your fiber-rich foods slowly over time, and increase your water intake with that, so that you don't lead to further constipation issues, because if you don't have enough water with the fiber, then you can kind of get blocked up, if you will. So you just want to be careful about that. Increase your fiber slowly over time. Don't jump from having 5 grams a day all the way up to 21 grams per day, because your gut is not quite going to be ready for that. And so you just want to work on that slowly. All right, so what are some things that can help with gut health if you feel like it's a little bit out of kilter? So probiotics and prebiotics are some things that you might see on the market. It's amazing how many products are now being fortified with both probiotics and prebiotics. I've seen cereals that say they have probiotics in them and things like that. So probiotics are foods or supplements that contain live bacteria, And the idea is that we're going to get these good beneficial bacteria down to your gut where they can colonize your gut appropriately. You'll find probiotics in, a lot of our cultured foods, like kefir, yogurts, and like I said, there are a lot of foods now that are being fortified with probiotics. Um, Kind of the thing with this is that it's not a one and done, that you can take, probiotic for a few days and have it completely overhaul your gut microbiome. This is something that you're going to have to continue over time to be able to see the benefits. And a lot of times, if you stop taking the probiotics, or consuming the foods that have the probiotics, you can stop seeing some of those benefits, just because there's turnover in the gut with the microbiome. So it's kind of something that you have to commit to a little bit longer term. Talk to your healthcare provider about especially the use of supplemental probiotics, and which ones are right for you. And, because there are different strains of the bacteria out there, and they may be able to recommend one over another. When we talk about prebiotics, these are fibers that are included in a lot of these products. Um, this is really the food for the bacteria in your gut. And it's, to help improve the balance of the microflora in the gut. There's specific fibers that are, best for those different types of bacteria, those that prefer oxygen versus those that can thrive without oxygen. And so that's what we're looking at as far as probiotics and prebiotics go. If you have if you're immunocompromised, I would talk with your healthcare provider about whether or not you should be taking probiotics, because there can be some issues if you are immunocompromised, because we are introducing outside bacteria into the gut, and that could cause you to, possibly have some reactions to that, um, in not a good way. So, common digestive problems as we age. We've touched on several of these already. The first that I see a lot with folks as we get a little bit older is that constipation, and we've talked about some of the reasons why. We do see slowing transit time as we get older. If we've got some chronic health conditions and medications that we're taking that we're putting on top of those normal age-related changes to our guts, then we can really start to see more issues with constipation. Um, and that's going to be, once again, different for everybody. For some people, it may be, I haven't had a BM in 3 or 4 days. This is constipated. Versus some people, if they're very regular, you may feel like you're constipated if you haven't gone in a little over a day or two. So that's also for you to know what's normal for you and know when it's not normal, and ask your healthcare provider about it. But ways to keep yourself moving, once again, increasing your intake of fiber rich foods as well as staying hydrated. Um, this time of year, it's a little bit cool up here in Tennessee. I'm so excited. We got down into the 50s overnight. So I forgot to check the temperatures in Georgia today. Hopefully you guys are cooling off too. Um, but this time of year I love because it's starting to be soup weather again. So if you're a person who really struggles with drinking enough fluids throughout the day, um, soups can be a great way to add a little more hydration into your day. And especially if you are including some of those good fiber rich foods in your soups, like the beans, and vegetables. I happen to make my 3 bean chili this week to take with me for lunch, and am absolutely loving it because I know I'm getting fiber, some protein, and also a little more fluids, and I can tell a difference. Um, Smoothies are another great way to increase both fiber and fluids in your day, especially if you use something like almond milk, which is not great on protein, but it has a little more water content to it, so that can be helpful along with the fruits. And if you add something like kale or spinach, that gives you a little bit more fiber and also a little bit more water in those produce as well. So that can help. And then if you add some yogurt to it as well, then you're getting some probiotics, and it's kind of a happy blend there. So thinking of ways that you can use different foods to increase your fiber as well as increasing your fluids with the foods can be really helpful. We talked about this a little bit earlier. Regular exercise helps with constipation too. Um, so, it's kind of, if you don't move it, you lose it. It's the same with your gut health a little bit. So if we move physically, then it gets that blood flowing to our gut, and it gets our gut moving as well. And then once again, if you're really struggling with constipation, talk to your healthcare provider about taking things like Metamucil, if that's going to be appropriate for you, because they know your health history. Acid reflux and GERD. We talked about this a little bit earlier too. A couple of other things that you want to think about with the acid reflux and GERD is to have smaller meals throughout the day. That can be very helpful to reduce the acid. Once again, paying attention to what are your trigger foods. They are different for everyone. I know for myself, I have some issues with acid reflux sometimes, and I can tell if I've had a larger meal, I'm going to have a problem. And if I have had something like a little too much cake or other foods that have more saturated fats in them, that's a problem in the evening. And then if I drink too much coffee at night. So paying attention to your trigger foods is really important. Having smaller meals throughout the day can help. Also, keeping the head of your bed elevated a little bit. So for some people, they need to get a wedge to help them sit up at about a 30-degree angle, maybe even to 45-degree angle as they sleep. That can be really helpful. Um, if you have acid reflux or indigestion on a occasional basis, you can take things like antacids, so that would be like your Tums or your Maalox. Once again, if you're taking other medications, talk to your doctor first or your pharmacist first to be sure that it goes with your medications, or if you need to think about timing around your medications. If you find that you're having acid reflux a lot more frequently, they do have those H2 antagonists, like famotidine or Pepcid, are available over the counter. Once again, talk to your doctor first before taking those, and especially if it winds up being a longer term thing that you have to do, you want your healthcare provider to be in the loop on that. They may say it's perfectly fine, you can buy over the counter. There are other prescription medications that are available that can help you as well. So once again, any digestive issues, talk about them with your healthcare provider. Diverticulosis is another thing that we see with folks as they age. A lot of times you've had this throughout life, but you might not have any problems until you do get a little bit older. So this is where these little pouches form in your colon, and they kind of poke out through the wall of your colon and can cause you some problems. On occasion, they will become inflamed and perhaps even have an infection, and this is called diverticulitis. At that point, you're going to most often require an antibiotic to treat the condition. But when it's just causing you some problems and it's not inflamed and it's diverticulosis, what we recommend is a high fiber diet, enjoying more of those foods that are higher in fiber, because once again, that's helping to move things through your system, and you're going to be less likely to have, some of the, if for lack of a better way of saying it, the fecal matter get caught in those little pouches, and that tends to be what leads to the pain that you can feel with diverticulosis. And then colon cancer is something that we want to think more about, how do we prevent it with diet? And, because the colon's part of the gut and part of gut health. So, what we know from research so far is that diets that are higher in fruits, vegetables, and whole grains, so those fiber rich foods, tends to be associated with a decreased risk of colon cancer. Also, limiting your consumption of red meats and processed meats, unfortunately, like hot dogs and sausages and those kind of things, that also tends to reduce your risk for colon cancer. All right. So, just want to share a little bit about where the current research around gut health and particularly the gut microbiome is going right now, and why is this research happening. So, what are the things that we've seen, um, through some of the cellular studies and then through some of the epidemiological studies that are leading researchers to look into, okay, what's the connection between your gut and your overall health, which includes mental health? And I find that so fascinating. So, what we've, discovered over the last many, many, many years that's really fascinating is that the bacteria in our gut outnumber our own cells by quite a bit. There are millions and millions of bacteria that are in our gut. And these bacteria can use and synthesize nutrients and other molecules unlike our own cells, especially in the lower areas of our gut. So when we're getting into the lower small intestine, and especially as we move into the large intestine and colon, bacteria become more and more important to those final digestive phases. And so they can use a lot of nutrients that our bodies can't break down and absorb, and then they can create new substances that can then signal other cells in our body to do different things. So they can secrete substances into the gut that then get absorbed into our bloodstream, and thus these substances can go to our brain and affect different things with our brain health. They can prompt what are called neuropod cells in the gut lining to stimulate the vagus nerve. So, excuse me, once again, that is that connection between the gut and the brain through this vagus nerve stimulation. They can activate those enteroendocrine cells to send hormones throughout the body. And these bacteria can influence immune cells and inflammation, either being protective against inflammation or causing inflammation if we happen to have, more of those not so beneficial bacteria in our guts. So, from what we've learned about the things that the bacteria in our gut do, that is now leading to where the research is going. So there's a lot going on right now looking at the connections between the microbiome flora and mental health, particularly depression, Alzheimer's disease, autism, and so many more. Some of the research out there has shown that people with depression have more of certain bacteria and less of certain bacteria compared to people who don't suffer from depression. And so this kind of makes sense when we talked earlier about the fact that about 95% of our body's serotonin is produced in the gut. So, if we can influence the bacteria that are in the gut to have more of those that help to produce that serotonin, then that might play one of those keys in treating depression. Also, looking at how that impacts Alzheimer's disease, because once again we're looking at total cognitive function. Different hormones and signals can play a role in that. How we form memories, whether or not we can form memories. Looking at things like Parkinson's disease, and so many more. It's just really a fascinating, rapidly growing field. So I've got a link to an article at the bottom, and I will try to get these slides out to you guys through Dr. Clack. But this is just a really interesting article about where some of the research is going. So I'm excited about this. I think we're going to see some more tailored therapies as we go based on the gut microbiome. And I just find that so fascinating. So just some kind of key takeaways today, and then I'll, have time for questions afterwards, or what have you. Gut health truly is related to general health. Um, we know that when we are feeling regular, we tend to feel better overall, and it's no wonder, because really and truly you can tell a lot of things about what's going on in your body by how your gut health is doing, right? To support our gut health, it's what we say for almost all of these talks, is that a healthy diet that includes those fiber rich fruits, vegetables, and whole grains, they truly do support gut health throughout your lifespan. And especially as we get older, it's even more important. We do tend to have more digestive issues as we get older. But once again, that general healthy diet can resolve a lot of those issues, especially when we pay a little bit more attention to having more fiber in our diet and staying hydrated as well. And then that current research that's looking at the gut microbiome's relationship to mental health. You've got to stay tuned over the next, I would say, 5 to 10 years. There's going to be so much more coming out about that. It's going to be really fascinating to see where everything goes. And so if you have any questions, and I'll have a little bit of time for questions afterwards, but you can contact me at one of these 2 email addresses or text me on my cell phone, and I will get back to you. And just as a reminder, next month we're going to be talking about low carb diets. Do they measure up to the hype or not? So I will look forward to seeing you in October, and I will take time for any questions that you have. And once again, there goes my name because I didn't have my eChem set up right today. Does anyone have any questions? Well, hopefully this has been a little bit helpful for you today to see yet another reason why focusing on those fiber-rich foods is so important. And I really encourage you to, over the next week or so, think about how you can get a little bit more fiber in your diet. Is it having more beans or those kind of things? Yeah, so Tasha has a question about recommending a particular brand or probiotic or prebiotic. I personally don't have any recommendations because I don't work with clients one on one and don't, prescribe them for clients. I would say to talk to your healthcare provider about any that are preferred. Um, for myself, I tend to read a lot of reviews online and try to, kind of sift through all of them. you're kind of looking for one, for me at least, it would be for the probiotics, those that have more colony forming units in them. Some tend to be on the, low end of like 40,000. I don't know that there's any benefit to it, but I look for those that are 50,000 to 60,000 colony forming units, or CFUs is what you'll see on the packaging. That's typically what I look for. But I would just double check with your healthcare provider, since I don't regularly work with people and prescribe probiotics. You're welcome. All right, any other questions? Like I said, I just hope that you'll think about more ways that you can get fiber in your diet over the next little while, especially as we go into the holiday season, focusing on, more fiber, staying hydrated, but then also practicing that really good self care of getting good sleep, good quality sleep, and managing your stress. That is going to help your gut health, and then your gut is going to help your overall health too. All right. Well, thank you all so much for being here today. I look forward to seeing you in October and hope that you have a wonderful start to fall season coming up this weekend. Hopefully, the weather's going to continue to cool off and maybe not be quite as rainy for a little bit. Um, and have great weather for you to get out, walk, enjoy everything, all those kind of things. So, once again, love talking to you guys. Can't wait to see you in October. Have a great rest of your week.